Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
Claim your life.
Picture this. You're in your 30s, feel a small lump during a shower, and immediately panic. You call your doctor, but they tell you you're too young for breast cancer and suggest you wait a few months to see if it goes away. You hang up feeling dismissed and confused. Should you push back, get a second opinion, or trust that age really does matter when it comes to breast cancer risk? This scenario plays out more often than you might think. Despite what many people believe, breast cancer doesn't discriminate by age, and being your own advocate can literally save your life. But how do you know when to speak up, what questions to ask, and how to separate fact from fiction when it comes to breast health? That's exactly what we're diving in today. If you are new here and you've landed on this episode, welcome. I'm Dr. Bayo, your health advocate. I'm a practicing family medicine physician in Reno, Nevada, and I bring what I see in clinic into the work I do on the news, on social media, when I travel around the country speaking, and to this podcast. This topic hits close to home, and I know how crucial it is to empower women with accurate information about their breast health, especially when misconceptions are everywhere. Fortunately, we have the perfect expert for today's conversation, Dr. Robyn Roth, known all over the internet as the Booby Docs. Dr. Roth is a board-certified associate professor of radiology specializing in breast and abdominal imaging in Southern New Jersey. But what makes her truly special is how she's revolutionized breast health education through her popular social media platform, where she discusses breast cancer and breast health. She's also the host of The Girlfriend's Guide to Breast Cancer, a podcast specifically for those navigating a breast cancer diagnosis or supporting a loved one through it. Beyond her professional work, she's a mom of three who brings both professional expertise and personal understanding to everything she does. Dr. Roth, welcome to the show.
Thank you so much. That was such a beautiful intro.
Well, we are happy to have you. So let's start with a couple of quick rapid fire questions to get to know you and this topic a little better. What's your favorite go-to drink at a coffee shop?
I always get an ice shaken espresso. I joke that I get one shot for a kid, but it's actually, I've cut down to 2 shots now, but that's my go-to. I need all the caffeine in the world.
I love it. Favorite healthy habit you prioritize?
I've lately been trying to walk 10,000 steps a day. I'm making sure to prioritize that. And also adding weights, incorporating weight training to my exercise routine is really important as well.
You know, walking is such a great way to implement exercise and trying to achieve those 10,000 steps, whether you make it or not. It's just lovely to have that goal. And
Yeah.
I believe I recently saw a study that you could actually do a little less. So you might already be meeting it. Yeah, I think it is 7,000.
Yeah.
Okay. What's your favorite way to unwind after a long day?
I am a sucker for reality TV. I've been binge watching Love Island. I'm going on the prior season, and I love The Bachelor. I love Summer House. Give me all the Bravo shows and the reality shows.
I'm right there with you. I love Real Housewives, even the one with the boat. I can't remember, below the deck. I'm like, sure,
below that. I'll take it.
I'm all in it. I love it. Okay. If you could get every woman to understand just one thing about breast health, what would it be?
You are at risk for breast cancer, unfortunately. The 2 greatest risk factors for developing breast cancer are being female and getting older. Wah, wah. So by definition, we are all at risk. And I think that's something we all need to take our breast health seriously.
And I know a lot of people are going to be surprised when we delve into our conversation, like all of the myths and surprise factors that people are not aware of when it comes to breast cancer.
Yeah, that was what drove me to social media in the first place, is just the rampant misinformation about breast cancer on social media specifically is really dangerous. And there are wellness influencers who see it as a big money business, and they are trying to cause confusion and try to pull away some people from what all their doctors are recommending. And I think that's really dangerous out there.
I agree. And that's why having this conversation and the work that you're doing is so important.
Thank you.
What's one question you wish every patient would ask but rarely does?
What are some things that I can do to lower my risk, and when should I start getting a mammogram? I think that's a great place to start. Right.
Yes. I'm really excited for people to hear about just in general breast cancer. We hear about it on social media, we hear it in the news, we might read about it as well. But sometimes that kind of underbelly, that understanding of what breast cancer is, can be
Uh-huh.
really hard to take in. Let's talk about the disease. What should
Mhm.
people understand when it comes to breast cancer? Give us the breast cancer 101 rundown.
I love that. So, breast cancer is not one disease, it's actually thousands of diseases. And it really depends on what type of breast cancer it is. Is it invasive ductal? Is it invasive lobular? Is it ductal carcinoma in sight? And then on top of that, it's also about receptors and how your breast cancer specifically responds to different hormones and treatment. And then plus size, grade, all these things really come into play when we're talking about breast cancer. So because your friend had breast cancer or your aunt had breast cancer doesn't mean that you're going to have the same type of breast cancer and the same type of treatment. Breast cancer is a very individualized approach to treatment and even diagnosis. So it's really important to understand that it's hundreds or thousands of diseases.
We hear that word cancer
Yeah.
and we kind of just focus on that. But I love that you broke it down. There are stages, there's grading, there's biomarkers, there's all of these things that are really important to know because if you or your loved one has been diagnosed with it, that sets the tone for
Mhm.
how you're going to get treated because it isn't a one size fits all. And
Absolutely.
that brings me to you see women at all stages of their breast health journey. What are the biggest risk factors people should know about, and how much of breast cancer is preventable?
Yeah. So I'd say that the two greatest risk factors are being female and getting older. But on top of that, there are certainly risk factors that we could talk about. So there's things that I like to call modifiable and non modifiable. Modifiable is the ones that we can change. And these are the ones where we could potentially make lifestyle modifications to lower a risk of developing breast cancer. It's estimated that about 30 to 40% of breast cancer is actually related to preventable causes or things that are in your control. So the big ones that I like to talk about are being overweight and leading a sedentary lifestyle, drinking too much alcohol. There's actually no, unfortunately, safe amount of alcohol. All of it increases your risk of many cancers, breast being one of them. So I think that alcohol is probably the most common risk factor that people partake in because it's so socially acceptable, but it does have risk involved with it. That doesn't mean that you shouldn't have a drink once in a while. I myself likes to have a drink once in a while, but I just think we have to keep it in the back of our mind as it's something that may contribute to our risk of developing breast cancer down the road. Also, eating a plant forward diet that's rich in fibrous leafy greens and minimizing processed meats, processed foods, all of those things. But I also want to say that even if you did everything right, you could still develop breast cancer, and breast cancer is not your fault. So don't be like, it was that drink I had last week. That was definitely what caused it. That's not true because there are lots of things that are out of our control. Being female, getting older, a family history of breast cancer. If you have a first degree relative of breast cancer, especially if it's someone that's premenopausal, that's one of the strongest breast cancer risk factors you could have. That almost guarantees that your lifetime risk of developing breast cancer is elevated. Also, having a genetic mutation. If you have dense breast tissue, that's an important one. So, once you have your first mammogram, you'll know if you've had dense breast tissue. That increases your risk of developing breast cancer and also makes it harder to find small breast cancer. I like to say it's a double edged sword. So those are the basic categories of preventable versus, modifiable versus non-modifiable risk factors. But what I will tell you is that we are seeing an increased rise in young breast cancer. The numbers are showing that it's actually declining in older women and rising in younger women. The greatest actual increase in breast cancer is women in their 20s. It's increasing at 2.2% per year. And a lot of times, the young people that are being diagnosed don't have the standard risk factors that we're looking for. They don't have a family history. They don't have genetic mutations. It's seemingly bad luck, but there's something going on. Environmentally, there's lots of environmental toxins that are out of our control, like we know about the microplastics, the pollution in the air, but also the lifestyle choices that we're making are probably contributing to this as well. I think we are more sedentary, smoking is more widely available, alcohol is more socially acceptable. So all these things I think are really contributing to a young breast cancer epidemic.
And there were so many gems that you dropped in that.
Hmm.
I loved it, and I want to elevate because they deserve to really be talked about again. So
Absolutely.
modifiable and non-modifiable. And I think it's really important for those who are listening. You want to think about what you can do to reduce your risk. And then you have what are your potential risk factors that you're born with that you may not be
Absolutely.
able to change. And when you make that list, it helps you kind of figure out this, I like to call it a delicate dance of what
Hmm.
are the pieces that I can change that I could actually make a decision of increasing my fiber, increasing whatever in my
Hmm.
diet, or maybe drinking one less glass of wine that week. And then the other
Absolutely.
pieces is digging into your family history, knowing all of those pieces, but still with the understanding that family history isn't, one of the
Hmm.
drivers. And this brings me to there's so much misinformation out there. And
Hmm.
we talked about in the beginning of the show with the influencers telling
Yeah.
you, oh, that if you drink this, if you do that. I'd love to talk about self breast exams. There's a
Hmm.
lot of information out there. And what are your thoughts on it? Because it's tripping up a lot of women.
So I am a very strong advocate of a monthly self breast exam, especially because we're seeing a rise in young women who are not being regularly screened for breast cancer, right? We don't start screening average risk women until age 40 with an annual mammogram. And we are seeing lots of women in their 20s and 30s, unfortunately, being diagnosed with breast cancer. About 80% of young individuals find their breast cancer themselves. Often it's accidentally in the shower, their partner might find it, but if we can be methodical about doing a monthly self breast exam, getting to know how our breasts normally look and feel, it will place us at a really big advantage when something pops up. Is this normal breast tissue? Is this how my breast always feels around my period? Because your breast consistency will change throughout the month based on your hormone. So it's really important. The best time to do a monthly self breast exam is a few days after your period when your breasts are least tender, least hormonally active. But I like to do feel it on the first. It's easy to remember. I love alliteration. I always do it on my page. I think it's just a good reminder. Anytime you're putting on a bra or putting on your clothes is really a good opportunity to do a self breast exam. And again, it's as simple as looking your breasts in the mirror, making sure they're symmetric in size, there's no rashes that you didn't notice or, dimpling. And then also just feeling your breasts in a methodical motion using, I like to say, the tips of two fingers in circular motion, making sure not to forget the clavicle and the armpit. There's actually breast tissue that goes all the way out there. I think a lot of the confusion comes from the fact that the American Cancer Society technically doesn't recommend a monthly self breast exam because they say it leads to too many false positives. But my argument is if we're not teaching women how to do a proper self breast exam, how will they actually be able to recognize when there truly is a problem? I kind of think it's dismissive and a little bit of medical gaslighting to say that don't feel your breasts, but also be self breast aware. Like we don't it just doesn't add up to me. I can't see any downside in educating individuals how to do a monthly self breast exam because there's an increasing rise in young breast cancer and more young people are being diagnosed with breast cancer and they're finding their abnormality themselves. Going back to what you said in the beginning is that a lot of times they're dismissed because of their age. They bring this area of concern to their healthcare professional. And often, unfortunately, they're told they're too young for breast cancer when that's not the case. The youngest case I've seen was 19. She had a genetic mutation, but I could see her being dismissed for a few months before it was actually taken seriously. I say be your own breast advocate. And if you feel something, say something. And again, when you feel something, most likely it's not breast cancer. Okay. But we want to make sure that it's not getting bigger, harder. These are the signs that we want to really pay attention to because normal breast tissue should be cyclical. It should get lumpy and then it might get tender at times and then it will go down in a few days. So if you just pay attention to it over the next few days, making sure it's moving in the right direction, you could get a sense of is this normal? Well, while you're trying to call your OB and remembering, oh, wait, am I due for my mammogram? All this is really important in keeping our breast health at the front of our mind.
As a family medicine physician, I share with my patients, yes, do your self breast exams.
Good.
I find it to be life changing where I've
Mhm.
had patients who have come in and have discovered because they checked it. Instead of waiting for your mammogram or waiting for something to all of a sudden pop up, if you have that information in advance, you and I know as physicians that early detection is key. And
Mhm.
that time when you discover, that can be life saving. That can
Absolutely.
change the stage, the grade, all the things that we talked about. And being able to, and I love that, check when you put your bra on. We'll have to figure out where I want to elevate that message. That's a
Mhm.
fantastic
It's
way
always
for
not
women to be able
it's a
to do.
it's a great opportunity.
Yes, I like that opportunity. I
Whenever
love
I
it.
can, I'm
That
gonna
is
do it.
amazing. Well, and that brings us to we talked about the self-care, which now everybody knows,
Mhm.
let's do it. Let's touch our breasts. Let's get in
Yes.
there. And then the other piece is there's so many guidelines that you and I follow that tell us how often a woman should have her mammogram. And
Mhm.
it can be very confusing
It is.
because you've got one guideline telling us every certain amount of time and another
Mhm.
one really not wanting to dip their toe in. So they're really vague. Let's just talk about it. What do you recommend when it comes to mammograms?
That's a great question, and like you said, there's so many conflicting recommendations, but annual screening mammography saves the most lives. So when you start your mammogram really depends on your risk factors, and this will bring me to my next important point. But average risk women should start annual screening mammography beginning at age 40, and you continue until you are no longer in good health and your life expectancy is less than 5 to 10 years. Like, let's say you are a very healthy 82-year-old, there's no reason to stop screening mammogram. 75 is the new 45. So there's no age to stop screening. If your life expectancy is at least another 5, 10 years, and if you found out you had breast cancer, you would do something about it, then you should continue screening mammography. So starting in age 40 for average risk women. Okay. So now is my important point that high risk women need to start breast cancer screening earlier and more often. I like to highlight this recommendation that all women, especially Ashkenazi Jewish and Black women, should have a breast cancer risk assessment at age 25, definitely before age 30, so we can identify high risk individuals that would benefit from earlier and more often screening. It's really easy. You can do it with your doctor, but your doctor has so many other things, especially your primary care doctor, your family medicine doctor. They have so many other things on their plate. So you kind of have to ask them, can we run my breast health risk score? Is this something we can do in the office? But it is very easy to do it yourself. I like to recommend the Tyrer Cuzick calculator. Google it. It's the one that Olivia Munn is always talking about. But there you can plug in your age, your height, your weight, your family history, when you had your first period, if you've ever been pregnant, and it will give you a pretty good estimate of your lifetime risk of breast cancer. So, average risk of developing breast cancer is about 10.5%. We all know 1 in 8 women will develop invasive breast cancer over their lifetime. That doesn't even include DCIS or in situ breast cancer. So, average risk is about 10.5%. If you are greater than 20%, that is considered high risk. Okay. And high risk individuals should start breast cancer screening as early as age 25 with an MRI, and then adding on a mammogram at age 30 and kind of alternating every 6 months. So when you hit 25, if you're high risk, you would start an MRI at age 25. When you turn 30, you'll add on a mammogram, alternate every 6 months. A good rule of thumb is like start breast cancer screening 10 years before a first degree relative that was diagnosed with breast cancer.
This is very helpful because, as we talked about, the guidelines are all over the place. And if you have that family history, or if you are in that high risk group that you just mentioned, there are a lot of things that could intercept your ability to get a diagnosis sooner rather than later. I often talk about with Black women, yes, we are dying at the highest rate, as well as getting the most aggressive. But now new studies have also shown it doesn't even matter about the aggressive type, it's all types that we are getting in respect to breast cancer. And I like to uncouple all of those areas because when we talk about race, I share with my listeners, it's the race is a social construct. So it's different than genetics. But what happens is often when a woman of color, if it's a Black woman, there may not be that thought with that clinician to check her for breast cancer or to think that she is at risk. And so, at all levels, whether you have a family history or not, especially if you are in that marginalized or high risk group, really being your best advocate and being able to have
Absolutely.
all of these things so you can say, I would like to be screened. I would like to get a mammogram. And I think those parts are very important when that patient is in the exam room.
Absolutely. Breast cancer disparities are a huge deal and they lead to about 40% higher mortality rates in Black women. It's not
Mhm.
just because they're developing more aggressive subtypes, which they are, but like you said, for all stages of breast cancer, more likely to die. We know that they're less likely to be offered high risk screening, less likely to be offered genetic testing, often less likely to have their complaints taken seriously. And I think that for a number of multitude of reasons, which you could do a whole episode about this, but culturally they don't talk about it as much with their family history. And, so I think that there's a lot of barriers to healthcare, especially in Black community and marginalized community like Hispanic and Asian American, Pacific Islanders. So it is a big, important topic. And it's why I am so passionate about educating and empowering people to understand their breast cancer risk and give them the tools that they need to bring to their doctor so they can say, I think I might be high risk. I think I need to have genetic testing. I need a breast MRI because I have dense breast tissue in my family history.
That language and that toolbox to be able to pull out,
Hmm.
especially because it can feel intimidating when you see the doctor. But if you have that language and also the data points or the receipts, let's call it,
Hmm.
to share why you need that.
I also want to say if you feel like your doctor is not taking your health complaints seriously and dismissing them, get a new doctor because the wrong doctor can be a barrier to your health care. When you want them to be on your team, it may not even be intentional, but for some reason, it's just not the right fit for you. You don't feel comfortable speaking up or you don't feel like they're taking your health complaints seriously. It might be time to find a new doctor. I think you have to advocate for yourself at all points throughout your health care.
I often share with people, I'm like, if that doctor isn't serving you, meaning your health, they do not have the right to
Hmm.
be a part of your health. It's just not allowed. And I think when people think about it in that space or take that gravity behind it, it makes it different because we kind of feel like we have to just walk through this level of dismissal or being gaslit. And absolutely not. It is your health and you have the right to be listened to be heard, and to be valued. And if that person isn't serving you, then you need to find a new doctor. Here's a reality check. According to recent statistics, about 1 in 8 women will develop breast cancer in their lifetime. But here's what might surprise you. Most women diagnosed with breast cancer have no family history of the disease. That means we all need to be informed about breast health, not just those with genetic predispositions. What do you wish more women understood about their personal breast cancer risk?
Exactly that. I think that being a female getting older, those are the two greatest risk factors. So we're all at risk and we have to take it seriously and even be a little proactive with our breast health. You might be the one who needs to ask your doctor if you can get supplemental imaging because you have dense breast tissue and you know that mammograms are not as effective. So I think that advocating for yourself, I like to say that early detection is a breast protection because breast cancer is treatable when we find it early. With early diagnosis, we have survival rates when it's stage one, it's greater than 95% survival rate. So these are great numbers. And that's what I would really encourage why we all have to take our breast health seriously. Because if we have breast cancer, which statistically us or someone that we love in our life is going to be diagnosed with breast cancer,
Mm.
unfortunately. So I think we all have to just keep that in the forefront of our mind. It's treatable when we find it early, even when it's caught late, it's still treatable. But obviously, like you said, that the survival rates and you live with this constant anxiety and fear of developing recurrence because you had metastatic cancer. We have to think about quality of life after breast cancer as well. They all go into play.
There are a couple of triggering words when we were talking and how you mentioned anxiety. And I think we need to talk about that woman who feels like she's being dismissed and she's trying to advocate for herself. And we
Mhm.
talked about if that doctor isn't serving you, find a new doctor. Now, what would you say to that woman who is told that she is overreacting or that she isn't at risk? And she is like, I don't know, I don't have another doctor to go to. I live in this very small town.
Mhm.
and I've got one person to see. Maybe it's my
Mhm.
primary, maybe it's an OB-GYN. What would you say to that woman to be able to help her navigate?
I would say that's a hard one because if you don't have access, you don't have access. And it might be worth a drive to a breast health clinic where you think your complaints might be taken seriously. I would start by going to a breast surgeon, would be the real person that you'd eventually want to get to, and they could do a physical exam, write the script for an ultrasound or an MRI or a mammogram, whatever you're due for. But I'd say don't just drop the ball because some doctor told you that it's nothing and you're too young for breast cancer, and don't worry, it's just a clogged duct. Especially if it's getting bigger and harder. I think you really need to push. Honestly, reach out to me on the Booby Docs and I'll give you some resources because I think there are resources out there of how to advocate for yourself. There are some great organizations like the Chrysalis Initiative, is a organization that will help give you the tools, especially if you're a woman of color, to have those conversations and give you resources where they know you can get help. Trust
Sick.
your gut. Don't give up.
We never know who's listening, and they may be in that situation. If that woman has now been diagnosed with breast cancer, it can be very overwhelming. It's
Mhm.
almost as if you're in a fog and you hear words coming at you, but you can't digest it.
Yeah.
What would be your advice for that woman who has just been diagnosed with breast cancer? What is the thing that she should do next?
I think she should take a deep breath and know that you're going to be okay. It's going to be a bumpy road for the next year or 5 or 10, but I'd say most of the patients end up coming out stronger after their breast cancer diagnosis because it gives them a new lease on life, new purpose. They've been through something really traumatic, but they come out stronger. Listen to my podcast, The Girlfriend Guide to Breast Cancer, because I think it really it started from the question of myself, like as a radiologist, I'm the doctor who's giving them the news of, this is breast cancer. And I'm the one who they ask me all the questions. What's next? Who do I see next? Who's my team? What does my treatment plan look like? It's all very individualized, but there's a certain few common denominators that are in breast cancer treatment that I think we should focus on. I would always say to go to your appointments with a loved one, someone that you could bring to your appointments that could listen when you can't and take notes. Okay. Because breast cancer treatment is usually going to look like some combination of surgery. Pretty much surgery is on the table for all patients unless you're not a surgical candidate or it's metastatic disease and there's no utility in doing surgery. It may or may not have chemotherapy associated with it, depending on, again, going back to the receptors, the size, the grade. Chemotherapy can be done before surgery or after surgery. If it's done before surgery, that's called neoadjuvant chemotherapy. If it's done after surgery, that's post surgical chemotherapy. And then there may or may not be radiation on top of that. Not all patients will need all of those. There's also hormone therapies. So a lot of times they'd have some hormone blocking medications, especially if you have a hormone sensitive type of breast cancer. So again, not everybody is going to have all four of those blocks. The earlier we can find your breast cancer, then we may be able to avoid chemotherapy or radiation or hormone blockers, but some combination of the four of those would be how breast cancer is treated.
Now, let's flip this around.
Mhm.
You mentioned you are the first line that shares with those patients their diagnosis of
Mhm.
breast cancer, which has given you insights into very intimate conversations.
Yeah.
And for the listener who is that caregiver, that family member who
Yeah.
is trying to provide support, what advice would you give to them?
I think the best advice would be to listen because what they're worried about might be different from what you would worry about. So find out what they're scared about, what worries them, and then you could be there for them a little bit better. So if they're worried about how they're going to do the childcare because they've got 3 kids and they've got a job, then you could really focus your resources on saying, we're going to help you with the carpool. We've set up a meal train so their kids don't have to go hungry after sport, things like that. So really listening to what they're worried about, what is scaring them, what is stressing them out. And then you could be a better helper going forward. Because when someone's like, what can I do to help? It almost places pressure on the person who's being diagnosed to come up with, like, you know what, can you do this? And they're just not there. Like they're processing so many emotions at the same time. But if you can say, what are you scared of? What are you the most anxious about? Can be a better way to say, what can I do to help? Because I think that they don't know how to help themselves. How could they know how you could help them.
I agree. And taking off one task that
Mhm.
they are responsible for, meal trains, I can say for my patients have been very helpful
Mm.
because that's one less meal that you have to worry about. And even in my family, those family members who've been diagnosed with cancer, just being able to have that where they're not worried about it, it's
Mhm.
huge. And even if it's just for a week, it's something that you can do versus, again, like you mentioned, putting that burden on your loved one.
Somebody recently, when I was helping a friend that was diagnosed with cancer, I set up a meal train. And she said that meal trains can be exhaustive for the receiver because there's a lot of
Oh,
scheduling and sometimes it's food that you may not be in the mood for. So they actually prefer like a Grubhub or a DoorDash gift card so that they could order food when they need it, what they want, what they're in the mood for. Because otherwise, we're just, you could end up with a freezer full of stuff like of casserole when you just want, a slice of pizza. So I think that's a good point.
that's genius. I never even
Yeah.
thought about that. Okay. It is like
Yes.
spread the word. Well
Yeah.
done. And that
'Cause
makes sense because we're trying to take the burden off. But if we're causing more
exactly. They're
harm by like, eat this food, you have to have this, that's
right.
terrible. But again, you
Yeah.
don't think about it because you are trying to go from, good intentions. That's, yep, noted.
Yeah.
Okay. I
And
will
also,
share
like,
that.
on the same note, it's like even like an Uber gift card so that they could get rides to and from their appointments without having to be reliant on somebody else when they may not be able to drive. So
Oh,
things like that,
love it.
let's normalize giving cash and gift cards to people that are going through a hard time.
If you could bust the top 5 most harmful breast cancer myths once and for all, which ones would you pick?
I would say 1 through 3 would be that mammograms cause cancer. This is such a dangerous narrative that is going on online, and it started from a really bad place. So, yes, mammograms have a very small amount of radiation. It's less than 3 milligram per view. It's equivalent to about 6 or 7 weeks of background radiation or flying cross country. Lots of imaging tests have radiation, a small amount of radiation, x rays of your chest, if you get dental x rays, if you get a CT scan, all those have a lot more radiation than what we're talking about. A CT scan specifically, PET CT, all that has a lot more radiation than a mammogram. But what a mammogram does that other imaging modalities can't is it can detect microcalcifications that can be the earliest form of breast cancer. Often it's DCIS or ductal carcinoma in situ, which brings me to number 2 of my myth, because there is a myth going on that DCIS is not breast cancer, when in fact it is early stage breast cancer. And if left untreated, it will progress to invasive cancer often. And often it's upstaged to invasive cancer at the time of surgery. So mammograms play an essential role in finding that early breast cancer that, ultrasound and MRI, as great as they are of imaging tests, they still can't pick up the microcalcification. So that is why a mammogram really does play an essential role. Yes, they've gotten better over time, and we're only going to see continued improvements. I personally think contrast mammography is the way of the future, especially in women with dense breast tissue and maybe an intermediate or high risk of developing breast cancer. But, mammograms continue to play a role in breast cancer screening. I still, as a breast radiologist, I'm very up to date on all types of medical imaging. And I would say there's nothing coming down I mean, breast CT I've heard a little bit about, but there's nothing that I'm excited about that I think will replace a mammogram in the near future. I still think that the small amount of radiation allows us to find the microcalcifications of early breast cancer, which DCIS is early breast cancer. That's my 1 through 4.
I love it.
Yeah.
And now that you've debunked those myths,
Yeah.
for the person who is considering a mammogram or
Mhm.
actually just putting it off, what would you tell them?
I would say early detection is the breast protection. The earlier we can find your breast cancer, then the better outcomes you're going to have, the less aggressive treatment you're going to have. So there's really no point in putting it off, because if it is breast cancer, unfortunately, it's not going to go away with your green juice diet or your bee venom that you're going to inject in your breast. Like, there, it is not going. It is breast cancer, and it will still be breast cancer in 2 or 3 years, but it might be now involving a lymph node or the liver. So really the goal is to find it early. So there's no better day than today to get your imaging tests, because again, ignorance is not bliss. The earlier we can find it, the better we can treat it and the better outcomes you're going to have overall.
Beautiful. What's a moment or message from a patient that stuck with you?
I think immediately to this time during fellowship. As a radiologist, like I said, I'm the doctor who's giving the news. And I'm also the doctor who's doing the biopsy. So if I know it's going to be breast cancer, I try to incorporate it through the biopsy. I say, if this is cancer, we're going to help you get this taken care of because, we're going to get you the best team around and we're going to get through this. So I like to lessen the blow by even mentioning the cancer as a possibility because a lot of times the rug is going to be pulled out from them no matter what you do, but at least putting it out there that this could be cancer. If this is cancer, we will help you get the team needed together that you need. But there was this one time in fellowship, and I had this lovely lady came in. She had ovarian cancer and she had multiple new masses in her breast. And we were worried that it was metastatic ovarian cancer rather than breast cancer. But we got along great. Like I did the biopsy great. We were joking. And then when it came time to give the news, I called her without reading the notes in her chart and without fully knowing the treatment plan. And I said, it came back, unfortunately, metastatic ovarian cancer. You're going to follow up with your surgeon and your team. And she wrote me this really long email and she said, I loved you. And I'm telling you this because I want you to be a better doctor. And I know you can be. But she said, that is not the plan at all. Like surgery is off the table. It is a change in my chemotherapy. It is not surgery. And she was right. Like I, I said, follow up with your surgeon. And that made her completely lose trust, any trust that we had built throughout the whole process. Well, I lost her trust from just that one thing without. So now I always read the notes. I look to see if somebody had called them beforehand, if they have a relationship with a primary care doctor who might be the better fit to give this news, if they have other metastatic disease and surgery is not on the table, or if this is because of where we are, a change in their chemotherapy. I like to know the treatment plan. And I always tell my fellows, read the notes, like know where this patient is. Have they received the news yet? I also make sure that they are not driving, that this is a good time, that they're not in their lunch break room with many people around. I like to really set the tone of like, is this a good time to talk about your results and make sure that it really is.
And that is putting the medicine into real real play for that
Yeah.
patient, because we see diagnoses that are bad
Mm,
often. And it's really easy for us to kind of just say the word and then move on to the next patient.
exactly.
But your story really reflects how the information that we are privileged to know about our patients' current standing or future is something that we have to cherish,
Absolutely.
because that trust is important, but how that patient moves forward and overall, like, what is going on in their life in that moment? Because although we're just going to share a couple of words, they have to continue to move forward. And it matters where
Hmm.
if they're driving, if they are about to celebrate something very special, it
Hmm.
can change the entire trajectory of their lives with that delivery. Well, I thank you for sharing that story.
I like to ask if let's say it's the weekend or they're going on vacation, I'm like, do you want to know before your vacation or if you'd like me to tell you afterwards? I really try to take into account how I would like to hear the news. Like if you're going to not enjoy your vacation because you're waiting on the results, then I might as well tell you beforehand. But if you're like, I'm going on a cruise, I don't want to hear it till I get back, I will respect that. And I think that's really important as well.
I agree. I tell my patients, let me know what is the best way for me to deliver the news to you,
Yeah.
just in general,
Hmm.
and then, kind of set those expectations. I love it.
Thank
So,
you.
Dr. Roth, this has been such an important conversation. I love how you make breast health approachable and empower women with
Thank you
real,
so much.
actionable information. I know our listeners will feel more confident about advocating for their breast health after this. For those who want to learn more about Dr. Roth, you can find her at the Booby Docs across all social media platforms. Her podcast, The Girlfriend's Guide to Breast Cancer, is available wherever you listen to podcasts. We'll have all of the links in our show notes. Dr. Roth, thank you again for joining. And are there any other things that you would like to share with the listeners? This was just a wonderful conversation, and I feel inspired.
If you're in the South Jersey, if you're in the New York, Philly, New Jersey area, I have an annual breast cancer fundraiser, the Booby Bash. which is going to be held October 18th. It's my third annual, and I love giving back to the breast cancer community. It's a great way to celebrate life and honor the thrivers.
I love it. I
Thank
love it.
you.
All right. Well, thank you again for joining
Thank
the show,
you.
and it was a pleasure. Dr. Roth, anything else you want to add?
So I want to go back to the misinformation. The people that are scaring you away from getting a mammogram, they're usually trying to sell you their thermography or their QT imaging or their unapproved breast cancer screening or their coaching program that, they can guarantee that you won't get breast cancer when there's actually no way to guarantee that. I think when you see information online that goes against what all your doctors and healthcare professionals are saying, I think you really need to look at the person's credentials. Are they a medical doctor? And is there some financial incentive that they're trying to push that might be making them say this controversial statement? Because it usually is.
It's very important
Yeah.
because that incentive, why are they sharing that they have this all for all cure? That's a
Hmm.
big red flag when
Hmm.
someone is touting that they can cure cancer or it's everybody's fault or this one person's fault. There is often more information behind the scenes. And
Hmm.
I appreciate you highlighting that. So thank you for being here and for
Thank you.
all
Of
the important work you do. Did
course.
something in this episode click for you? Consider sharing this with someone you love who might benefit from this knowledge. Because here's the thing, taking care of your breasts is all about being informed, being proactive, and knowing that you have the power to advocate for yourself. Early detection saves lives, and knowledge is your best defense. You've got this. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark. Ooh.